Hello, my name is Joyce Lee, and I'm a nursing student at the University of Michigan. My patient is a 19-year-old Korean male who is a freshman at U of M and is single. The patient uses private home physician. However, the last time he went to the clinic was a physical checkup for his track junior year of high school. On March 22nd, 2017, I checked his vital signs, and his vital signs was that the blood pressure was 139/90, his temperature was 89 degrees, and his pulse was 74 beats per minute, and his respiratory rate is 16 breaths per minute. He is 179 centimeters and 175 pounds. The patient has no chronic or serious illnesses. The patient receives flu shot every year and is up to date on all shots. Patient has rhinosinusitis since birth, and seasonal allergies include hay fever as his sinuses are congested. Patient has no food or drug or medication allergies. Patient has had his wisdom teeth taken out 2 years ago. They prescribed him with painkillers like prescription strength ibuprofen Motrin every 6 hours for a couple weeks. At age 6, he was sent to the emergency a couple times to get stitches on his head, eyebrow, or elbow. Patient takes 2 Advil pills twice a week when he gets a headache and takes supplements of vitamin C. Patient does have alcohol intake every other week when he takes 2 shots of hard liquor when he goes out, but he does not do any drugs or tobacco use. Patient used to exercise twice a week by focusing on cardio and lifting weights, but stopped due to his current back problem a month ago. Recently, in late March, when his pain was 2 out of 10, he joined a dance group, and they danced twice a week for 2 hours. The patient gets the average 6 hours per night, and his diet is average. However, he likes to eat late-night junk food that is high in carbs and fat, which is like Wendy, Bubble, and Pizza House. He is not concerned with his diet currently, and he avoids any caffeine intake or any use of safety device normally. The patient has a healthy social and personal time to himself. The patient also has a strong and solid friendships and family relationships. He used to live near factories, but throughout his life, the overall air quality is good. The patient tends to get stressed when he thinks about his future and what to major in, and also when he takes on responsibilities. He releases the stress by watching Korean dramas or singing gospel songs. The patient, again, is a freshman at UMICH and is currently undecided but leaning towards computer science. The patient's family history is that both sides of the family has high cholesterol levels and history, and his grandpa on his mom's side died with COPD, which ultimately ended his life at age 79. There is a history of heavy drinking from both sides of the family. His grandpa on his dad's side died with liver cancer because of abusive drinking, which ultimately ended his life at age 86. The patient parents do not drink, but his dad had testicular cancer. The patient has one younger sister who is 1 year younger, as she has seasonal allergies like him. Patient chief complaint is that he is having a checkup for his back after having back pain since January 21st, when he was carrying something heavy and fell. When putting pressure on his back or having sudden movements, he gets a throbbing, tense pain in his lumbar area close to the tailbone and sacral nerves, maybe around L2 or L3 area. Pain on January 21st was rated 8 out of 10. Then on February 14, it was rated 4 to 5 out of 10, and then in March 22nd, it was rated 2 out of 10. The duration which the pain was tense was for about 3 weeks starting on January 21st, 2017. A precipitating factor can be improper lifting, and the quality is medium. There is a risk for fall. Unfortunately, he does still carry a heavy backpack for his class, so I recommend to take a lighter load for a while. The patient is recently recovered from his injuries, but the pain was progressive and started off with having trouble, but is still capable of getting out of bed, bending over to pick up something, or tying his shoe. And the patient was hurting even after sitting for a long period of time. Also, it hurts when he lifts his leg above his hip. The patient takes around 800 milligrams of Advil occasionally to help relieve the pain. Also, he has been trying this Korean hot patch. The patient is stubborn and decided to wait and the pain off and stretch the soreness. He refuses to go to UHS. There are no associated symptoms, and and no interference with normal daily activities. Patient also complains about having chest burns in his upper left chest. He gets heartburns every 3 months and describes it as if someone was stabbing you in the heart. He rates his pain 6 out of 10. His chest pain started since 6th grade. Patient has not taken any medication for this, nor it has been interfering with daily activities, and there is no aggravating or relieving factors. Based on the present history, I've chosen to do musculoskeletal and heat on February 14. Patient muscle mass and bone structure is symmetrical and with no atrophy, erect posture, and smooth and coordinated gait. No signs of scoliosis. Spine is straight and midline as he has a full range of motion of TMJ, neck, shoulders, elbows, wrists, fingers, hips, knees, ankles, and spine. Even though he has tense back pains, he is still able to do full range of motion. Also, there is no sign of arrhythmia, inflammation, warmth, pain, and crepitus, with the exception his back pain, where his hips and spine had slight arrhythmia, inflammation, and warmth. Deltoids, biceps, triceps, wrist, fingers, hamstring, quadriceps, and ankle all passed with a grade A muscle strength of 5 out of 5. They were all equally felt and bilateral, with the exception of his hip, as it was graded 3 out of 5 when testing the muscle strength adductors and abductors. Now moving on to heat, which is the head, eyes, ears, nose, throat assessment. Patient's skull has normal size and shape. His hair has an even distribution, no dandruff, and no pest inhabitants, but there is a nodule that is in the back of his head, which was there since birth. The patient has a symmetrical face, has symmetry with frowning or smiling. The patient has appropriate color to the race, and overall structure is symmetrical. The head is midline, neck muscle is symmetric, and neck is active. Range of motion is smooth and controlled. The trachea is midline, and there's no enlargement of thyroid glands. The cervical lymph nodes have no enlargement greater than 1 centimeter, and there is no tenderness. When I inspected his eyelids and eyelashes with my pen light, there is no swelling, discharge, or lesions. There is even distribution of eyebrow and eyelashes. There is no ptosis, and the conjunctiva is most moist and clear with small vessels. Sclera is white, cornea is smooth and light, reflex is symmetrical, and iris is round, and color is bilateral. Testing the pupils, referring to cranial nerve 3, 4, and 6, are round, equal, and retract to light. Pupils move parallel in 6 cardinal field of gaze, fixed steady gaze during accommodation, and red reflex present bilaterally. When palpating the lacrimal apparatus, the patient does not have any abnormalities or tenderness. The gland and sac is not palpable. When testing visual acuity, cranial nerve 2, I used the Rosenbaum to figure out what the patient has, and it's 20/20, meaning the patient can see clearly at 20 feet, which is the normal vision of sharpness. The patient has normal visual fields, cranial nerve 2, and no peripheral field loss. When assessing extraocular muscle function, there is parallel tracking bilaterally, and when assessing corneal light reflex, the reflection of light is mirror image. I tested both left and right eye. For the cover test, there is no lateral or upward-downward eye movement. When inspecting and palpating the ears, they were symmetric in shape and size, color, and configuration. There is no swelling or thickening. The skin is intact with no lumps or lesions. The pinna and tragus is firm yet movable and no pain with movement. The mastoid process is free of lesions and again no pain with movement. The external auditory canal is patent, free of drainage, no swelling or redness. When also doing the hearing test, which is the cranial nerve 8, for example, whispered voice test, the patient is able to hear and repeat each word correctly. When doing the Rhine test, it is positive AC is greater than BC. When doing the Weber, it is midline and sound equally in both ears, and when doing Romberg, there is no excess swing or loss of balance. And for the nose and paranasal sinuses, the external nose is symmetric midline in proportion to other facial features and no deformity, inflammation, or lesions. The nares is patent, stiff, sniff present bilateral. For the nasal cavities, mucosa dark pink and smooth and moist, and no swelling, discharge, bleeding, or foreign bodies. The septum is midline and straight and intact and without bleeding or growth. The frontal and maxillary sinuses have no pain with palpation. For the mouth and throat, lips are smooth, pink, free of lesions and cracking. The TMJ is smooth with movement, no tenderness or limitation in range of motion, and no pronounced clicking. The buccal mucosa is pink, smooth, and moist, no lesions. The teeth is white, straight, evenly spaced, clean, free of debris or decay. Gums is pink coral with dotted surface, no swelling, retraction of margins, bleeding, or discoloration. The tongue is mobile, pink dorsal surface, more rough. ventral surface is smooth, and it's glistening, and with veins, saliva is present. Floor of mouth, there's no white patches, nodules, or ulcerations. For the hard palate, it is white with irregular transferred rugae, and soft palate, it's pink, smooth, and upwardly mobile. The throat posterior pharyngeal walls, its tonsils is pink, peppered with indentations. The size is +2 and no lesions. Hypoglossal nerve, which is cranial nerves 8, is tongue protrudes in the midline, no tremor, loss of movement, or deviation to the side. Glossal pharyngeal nerve, which is cranial nerve 9, is soft palate and uveal rise in midline when the patient says ah. Vagus nerve, which is cranial nerve 10, is intact gag reflex. If I were to do 2 other assessments on my patient, it would be cardiac and genitourinary assessments. Because my patient has frequent chest pain since 6th grade, and at his age, he is prone to testicular cancer since his dad had testicular cancer, which is also known as a young man disease. According to Mayo Clinic, a wide range of health problems can cause chest pain. Even though the chest pain is a symptom, it is attributed to heart disease. Therefore, this discomfort or tightness the pain feels should be checked before chronic problems occur. It never hurts to check to see if there is a problem. Therefore, I would inspect for heaves, lifts, palpating for lifts or thrills, and auscultating for any abnormalities of the chest in 5 key areas, which is aortic, pulmonic, herbs, tricuspid, and mitral. And according to National Cancer Institute, states that testicular cancer is most common cancer in men from ages 15 to 34. Even though it can be cured more easily, it can cause infertility by decreasing the amount of sperm made by the body. Therefore, it is better to find it early onset. Therefore, I would do GU assessment and care special attention to the scrotum, because that's where a common area where lumps can be detected. And here's my reference. Thank you. So after the physical examination, we went to review the systems, and so aside from what is mentioned, he has no joint pains or deformities, he has no weakness and no history of arthritis. For hint, it's head, ears, eyes, nose, and throat, and he has some headaches, but he takes Advil to relieve them. He doesn't have dizziness, vertigo, fainting. He does have pain in his knee when he puts pressure on it, and when his back hurts. His vision is correct and no changes, no glaucoma, cardiacs, or injuries. He does have acute hearing like his family, and doesn't have frequent ear infections. For bleeding, he did have a lot of nose bleeds 3 times a day for about a month in middle school. Last eye exam was this summer. He doesn't remember his dental exam. He doesn't have hoarseness or frequent cold, strep throat, or sore throat. He doesn't have trouble swallowing, and he never received radiation therapy to his head, neck, or face, and he does not have neck pain or tenderness. Thank you.